Mental health issues affect people of all ages, there's no doubt. And that includes our school-aged children. Can be brought on anxiety from the classroom, their groups of friends. The lockdown may be having a detrimental impact as well. So how do you have that conversation with the kids? Joining us now is Tania DaSilva, child, youth and family therapist. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
I want to divide this conversation a little bit into two, our younger children under 12 and then our teenagers. Let's start with the young ones. How do we introduce the topic of mental health with the young ones?
So we actually typically do it the same way for both age ranges. We talk about the connection between physical and mental health. So we really want them to see that there is a mind-body connection and both of those things need attention. So we go into what does physical illness look like, what does physical pain look like, and then what does mental illness look like, and what does mental pain potentially look like as well. And the most important thing is developing that awareness in terms of what different things can go into impacting our physical health negatively, which most kids know, but really developing their awareness about what can go into really impacting our mental health negatively as well. And we use this thing called the 3 S's. So speak up, slow down, and start up. And if we're looking at physical pain, most people know you need to speak up when something's hurting. You need to slow down to give your body time to recover. And you need to start up some type of therapy or process to feel better. So we really want our kids to know that it's the same thing with mental health. You want to speak up when you're struggling. You want to slow down to give yourself time that you need and start up therapy if that's what is going to help you feel better.
Okay, let me give you an example and you tell me how a mother or father would handle this. A 7-year-old is maybe having a little bit of a struggle right now. Online learning, maybe a little more tired, irritable. What does mom or dad do to talk to them?
Well, and that's super common. Like we've been hearing this from all of our families where it's becoming harder and harder because this has been going on for so much longer now. So really just creating that safe space to clue into what you're noticing. So I see that you're irritated because of, your facial expressions or what you're saying or the way you're acting. So that really points out what you're seeing and helps them create that connection to their own emotional awareness. So,
like validating what they're saying?
When I feel this, when I do this, this is what I'm going through. So I always start with that awareness first because a lot of kids don't have that awareness. Their emotions are controlling them and they're kind of just following along. So you always want to start that conversation about what you're noticing and then again, connect it to the triggers. So why might that be happening? This is what I think, but what do you think? It helps them to really develop that critical thinking about what is impacting my mental health and my mood.
Okay, so essentially, I want to make sure I understand this. You're helping put words to how they're feeling. Like you said, I see you're making faces that are not what you normally would make. Maybe you're feeling X, Y, Z. And then you're asking them after that to help understand or label it a little bit more with how it makes them feel.
So a lot of our kids don't have emotional language. So
right.
That's where we need to come in and really help them develop that and make the connection. With our older kids, with teens, they typically do. So it's actually helping them make sense of their feelings and their perceptions and interpretations. So that does change a little bit with age.
Can that discussion alone change things and improve their mental health, just starting from that?
Absolutely. I notice it all the time when we start having these conversations at a younger age. They really start getting it and they start making those connections early on. So I know people think, oh, well, it's just a conversation, but it's not that. We're bringing attention to something. And once you've brought attention to something, you can't unsee what you've seen. So it really just helps kids become more aware. And you'll start noticing that they start bringing things to your attention throughout that as well, where, you know what, actually, I did use this, or I did notice that this bothered me. And it just actually helps the conversation to continue.
Yeah, I think that's really important because you want them to be able to feel that with time they will have the skills to be able to come to you instead of fear that they can't talk to their mom or dad. And at the end of the day, is it help to them if they're struggling to give them some encouragement? You're doing a good job, buddy, with online learning. I know it's not easy, but you're really pulling through and I'm proud of you. Does that make a big difference for them?
It does. I mean, for some kids, they might get a little agitated where it's like, okay, you're telling me I'm doing a good job, but I'm still not enjoying it. So I think validating their feelings is always really important, where it's like, I see why this is hard.
Okay.
I see why you don't like it. Really playing into their perspectives and then obviously giving them that praise too, where you are doing a good job. But I always like to couple it with both. Like first you want to validate their emotions and tap into their perspectives before you give them basically a put up saying that you're doing a great job.
Right.
Because sometimes kids feel like we're invalidating their emotions by not even acknowledging that they're struggling with something. coping, and we're just telling them that they're doing great and they should keep going. So I usually kind of couple both of those things together.
That is such important information right there. We certainly don't want to dismiss them. What they're feeling is important no matter what it is. Great information. Tania DaSilva, of course, this conversation we could keep going for so long, and I hope some parents at home got something out of this today. Child, youth, and family therapists, really appreciate your time. There's all the information on your screen for how you can take part in Bell Let's Talk. When we talk about our kids' mental health, it is a big one, and certainly this year, unlike any other. So text, tweet, talk, 5 cents Bell will donate for every Bell Let's Talk hashtag that's put out there to mental health initiatives across the country. Be part of it.